Welcome to Soulsonneta, where we explore the depths of health and well-being. Today, we're delving into a topic that affects millions worldwide: cancer. Join us as we uncover the types, causes, symptoms, prevention, and management strategies for this complex condition. Knowledge is power, and we're here to empower you. Before we proceed, remember that this content is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider for personalized guidance on your health and medical conditions. Let's get started. Cancer is a term for diseases characterized by uncontrolled cell growth, and it can occur anywhere in the body. Understanding this condition is crucial for early detection and effective management. Types and causes. There are over 100 types of cancer, each with its unique characteristics. Most common ones are: 1. Breast cancer. Forms in the breast tissue and can occur in both men and women. Different subtypes exist, like ductal carcinoma and lobular carcinoma. Causes: hormonal factors, estrogen exposure, genetics, BRCA genes, family history, age, and lifestyle, alcohol, obesity. 2. Lung cancer. Primarily associated with smoking but can also occur in non-smokers. Subtypes include non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. Causes: smoking, leading cause, secondhand smoke, exposure to radon gas, asbestos, and other carcinogens. 3. Colorectal cancer. Affects the colon or rectum. Subtypes include adenocarcinoma and carcinoid tumors. Causes: age, family history, genetics, Lynch syndrome, diet, red and processed meats, low fiber, and inflammatory bowel diseases. 4. Prostate cancer. Affects the prostate gland in men and is usually slow growing. May not cause symptoms in its early stages. Causes: age, more common in older men, family history, and race. African American men are at higher risk. 5. Skin cancer, melanoma. Develops in melanocytes, skin pigment cells, and is often linked to UV radiation exposure. Can occur anywhere on the body. Causes: UV radiation, sun exposure, tanning beds, fair skin, history of sunburns, family history. 6. Ovarian cancer. Often diagnosed at an advanced stage as symptoms are subtle. Subtypes include epithelial, germ cell, and stromal tumors. Causes: genetics, BRCA genes, family history, age, hormonal factors, and endometriosis. 7. Pancreatic cancer. Typically diagnosed at an advanced stage and is challenging to treat. Subtypes include adenocarcinoma and pancreatic neuroendocrine tumors. Causes: smoking, family history, genetics, BRCA mutations, chronic pancreatitis, and diabetes. 8. Leukemia. Affects the blood and bone marrow, leading to abnormal blood cell production. Types include acute lymphoblastic leukemia, ALL, and chronic lymphocytic leukemia, CLL. Causes: genetic mutations, exposure to radiation, certain chemicals, benzene, and family history. 9. Brain cancer, glioblastoma. Affects the brain or spinal cord. Glioblastoma is one of the most aggressive forms. Causes: genetic mutations, exposure to radiation, ionizing radiation, and rare genetic syndromes. 10. Cervical cancer. Develops in the cervix and is often linked to persistent HPV, human papillomavirus, infection. Causes: HPV infection, smoking, multiple sexual partners, and weak immune system. 11. Thyroid cancer. Forms in the thyroid gland and is often detected early. Subtypes include papillary, follicular, and medullary thyroid cancer. Causes: exposure to radiation, especially during childhood, genetics, and family history. 12. Bladder cancer. Develops in the lining of the bladder. Subtypes include transitional cell carcinoma and squamous cell carcinoma. Causes: smoking, exposure to certain chemicals, e.g., in the workplace, chronic bladder inflammation, and family history. These are just a few examples of the many types of cancers, each with its unique characteristics and underlying causes. Early detection and understanding risk factors are crucial steps in prevention and management. Transition to symptoms. Recognizing cancer's warning signs is essential for early intervention. Symptoms depend on the type and stage but may include unexplained weight loss, fatigue, changes in skin or moles, and persistent pain. Prevention. Preventing cancer often involves making healthy lifestyle choices. We'll explore in detail 2 major preventive measures. 1. Diet for cancer prevention. Fruits and vegetables. These are rich in antioxidants, vitamins, and minerals that help protect cells from damage. Specifically, cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that may reduce the risk of certain cancers. Fiber-rich foods. High-fiber diets, including whole grains, legumes, and fruits, may reduce the risk of colorectal cancer. Fiber aids in digestion and helps maintain a healthy gut. Lean proteins. Limit red meat consumption, especially processed meats like bacon and sausages. Opt for lean protein sources like poultry, fish, and plant-based proteins like beans and tofu. Healthy fats. Choose unsaturated fats found in olive oil, avocados, and nuts over saturated and trans fats. Omega-3 fatty acids from sources like fatty fish, salmon, mackerel, are known for their anti-inflammatory properties. Limit sugar and processed foods. High sugar intake and processed foods have been linked to an increased risk of obesity and certain cancers. Reduce consumption of sugary drinks, snacks, and processed foods. Moderate alcohol. Excessive alcohol consumption is associated with an increased risk of several cancers, including breast and liver cancer. If you drink, do so in moderation. Hydration. Staying well hydrated is important for overall health. Drinking water and herbal teas can help flush out toxins. 2. Herbs and spices for cancer prevention. Turmeric. Curcumin, the active compound in turmeric, has potent anti-inflammatory and antioxidant properties. It may help prevent and slow the progression of certain cancers, particularly colorectal and pancreatic cancer. Garlic. Garlic contains allicin, a compound with potential anti-cancer properties. It may reduce the risk of stomach and colorectal cancers. Crushing or chopping garlic before cooking enhances its health benefits. Ginger. Gingerol, found in ginger, has anti-inflammatory and antioxidant effects. It may help inhibit the growth of cancer cells and reduce inflammation associated with cancer. Green tea. Rich in catechins, green tea has been studied for its potential cancer-preventing properties. Regular consumption may reduce the risk of various cancers, including breast, prostate, and lung cancer. Rosemary. This herb contains rosmarinic acid and other compounds that have demonstrated anti-cancer effects in lab studies. It may inhibit the growth of cancer cells and reduce oxidative stress. Cinnamon. Cinnamon is loaded with antioxidants and has anti-inflammatory properties. While more research is needed, it may help reduce the risk of certain cancers due to its ability to combat inflammation. Oregano. Oregano is rich in compounds like carvacrol and thymol, which have shown potential anti-cancer activity in research studies. Basil. Basil contains compounds like eugenol, which may have anti-inflammatory and anti-cancer properties. It's a versatile herb that can be added to various dishes. Remember, while these diets, herbs, and spices show promise in cancer prevention, they should complement an overall healthy lifestyle. A balanced diet, regular exercise, avoiding smoking, limiting alcohol, and maintaining a healthy weight all contribute to reducing cancer risk. Always consult with a healthcare professional before making significant dietary changes, especially if you have underlying health conditions or are taking medications. Management. If diagnosed, cancer management depends on type and stage. Options include surgery, radiation, chemotherapy, immunotherapy, and targeted therapies. A multidisciplinary approach is often used. Support and emotional well-being. Cancer takes a toll not only on the body but also on emotions. Seek support from healthcare providers, support groups, and loved ones. Emotional well-being is an essential part of the journey. Thank you for joining us on this exploration of cancer. Remember, early detection through screenings and a healthy lifestyle can make a significant difference. Stay informed and empowered. Don't forget to subscribe, comment, hit that notification bell, and join us on our quest to empower you with health knowledge. You can as well let us know of any disease or ill health you would like us to talk about in the comment section below. At Soulsonneta, all we need is your well-being. So, we also drop soul-inspiring videos on practical poems and their respective applications to our daily endeavors from time to time. See you in the next episode of this series, where we shall be discussing respiratory diseases, the meaning, types, causes, prevention and management techniques.